Okay, Sanmanani everyone. I want to talk about cystic fibrosis today because I felt like I need to address cystic fibrosis and what it is for people to understand what cystic fibrosis is, or what really am I going through, other than people assuming. Because, well, yesterday I posted my Sunday pictures on Twitter, and then they went viral. They're still going viral, and so it drew a lot of attention, and people asking if it was COVID-19 or if it was HIV and AIDS, or so many questions. People wanted to know what really is going on with my life. So I thought I should make this video so I can also share it on YouTube and share the link on Twitter, so that they can go through the link and probably get to know what really is going on with me and my journey. So yeah, okay, I'm battling a disease called cystic fibrosis. And so cystic fibrosis is a hereditary disease. So hereditary, like it comes from the family genes and so on and so on. So it's in my genes, and there's nothing I can do. So it affects my lungs and my digestive system. And also the body produces sticky mucus, and then it clogs in the lungs, like the pathways where you like trying to breathe. Where you're trying to breathe, for me it's hard because the mucus is in the lungs, and I have to always try to take it out and so on and so on. So yeah, I guess that's what cystic fibrosis is, and I'm going to try and Google more and more. How do you get cystic fibrosis? Okay, cystic fibrosis is a genetic disease. People with CF have inherited 2 copies of the defective CF gene, 1 copy from each parent. Both parents must have at least 1 copy of the defective gene. People with only 1 copy of the defective gene are called carriers, but they do not have the disease. So my parents are the carriers of the disease, and so it means I have 2 copies of the defective genes of the disease. So yeah, that's how you get the disease. And then can people with the disease live longer? Based on the 2018 registry data, if your child with cystic fibrosis is born between 2014 and 2018, you can expect them to live at least 44 years. If your child is born in 2018, they have a 50% chance to live till they are 47. So unfortunately for us, we were not born. Now that like there's technology, there's new medication, there's new drugs, and so on and so on, but we can still manage, I guess. Yeah. Yes, here's another question that I just want to, like, people ask: can you get cystic fibrosis at any age? It's like people always ask me, have you always been this sick? How did you get the disease? That's the question that people always ask me. How did you get the disease? And so, while cystic fibrosis is usually diagnosed in childhood, adults with no symptoms or mild symptoms during their youth can still be found to have the disease. So, like, you are born with the disease, and then as you grow, it progresses from minor to major, and then eventually, so yeah. So you are born with the disease. There's no way that I can really say when I really got sick. I've always been sick. What is the end stage of cystic fibrosis? Okay, the end stage lung disease is characterized by cysts, abscesses, and fibrosis of lungs, and airways. Patients frequently die from overwhelming lung infections. That is why we always have to have antibiotics to curb the infections in the lungs. So yeah. I'm trying to get as much information as I can, because the rest I know so much, so I'm like trying to just get the basics of the disease. You are born with the disease. They're trying to emphasize that. Build up of thick sticky mucus that can damage many of the body organs. Yes, the issue with cystic fibrosis is that it doesn't necessarily just affect the lungs, it affects the entire body. And so that means that like my entire body is affected by the disease, and so even when I get new lungs, it doesn't mean that I'll be totally healed from the disease, or like I'll be free from other things that will make me sick. No, the lungs would give me I'll be able to breathe freely without having too many difficulties and so on and so on. But that doesn't mean that I won't still have the disease. So long as the disease is in my genes, I'll still be sick and so on and so on. So yeah. So what is this? I don't even know. I'm trying to get something here. I'm trying to do something. This is so sad. No. Okay. So yeah, like you guys, the comments on my post, I think most of them were just based on prayers and questions on what really is going on with me. I just have cystic fibrosis, and so yeah. Okay, symptoms of cystic fibrosis: recurring chest infections. Like you always have chest infections, and there's nothing really that you can do. So except to always try to manage them with the antibiotics and so on and so on. And then the wheezing, like always, wheezing, coughing, shortness of breath, and damage to the airways or bronchitis. Like I'm always wheezing. Yeah, you know. Difficulty putting on weight and growing. Like I've recently lost weight and I'm hating it, but yeah, like I can see here on my cheekbones. So yeah, part of it. And then there's jaundice, and then there's diarrhea, constipation, or large smelly poo. So we always need creon to help with the digestion. Bowel constriction in newborns. Meconium ileus surgery may be needed for the babies. Unfortunately, I'm old for that now, I guess. Yeah. How do you know if you have cystic fibrosis? Because other people assume they have it. Yeah. Very salty skin. Yeah, like when you try to scratch yourself, you get this salty flakes. And then persistent coughing at times with phlegm. For me, it's always with phlegm. There's nothing, there's like, yeah. Okay, frequent lung infections including pneumonia or bronchitis, wheezing or shortness of breath, poor growth or weight gain, in spite of good appetite. Well, my appetite is zero, but I try. And then frequent greasy, bulky stools or difficulty with bowel movement. And male infertility. Yeah. Can you get cystic fibrosis at any age? No. What happens to your body What happens in the body to cause CF? Nothing. How do doctors diagnose? Okay. Is there mild form of CF? At what age is CF usually diagnosed? Okay, yeah. This is me, guys. Like, there's nothing more. So yeah, I'm just battling the disease and giving it my all and trying my best. Yeah. So yeah, hopefully you get the link on my YouTube channel and you follow the video and you learn and you know, like, I'd say people are ignorant or whatnot. I don't know, but yeah. So I'm trying so hard not to say the word ignorant, but I'm getting there, because some people are still saying that these are earphones. Like, hello, earphones. These are not earphones. These are not earphones. They are nasal cannulas. Nasal cannulas. So it's not earphones. So yeah. I'm still trying to educate, but yeah, that's about it. Cystic fibrosis is what I'm battling with and giving it my all, despite whatever happens. And so yeah, keep me trending. Alright, bye.